A lot of Nigerians were stunned when they heard about the outbreak of monkeypox in Bayelsa State, south Nigeria. Now, chickenpox would have been more familiar. A lot of people had heard about that, but monkeypox was quite strange to a lot of Nigerians here. And to discuss ways to prevent this disease, we're being joined on the program by a Dr. Oluwakemi Odukoya, a public health physician from the Department of Community Health and Primary Care at the Lagos State University Teaching Hospital, LUTH. Thank you so much for joining us on the program.
Thank you. You're welcome.
Practitioners say there is no known cure for monkeypox disease, but why is this so?
Well, monkeypox is a disease that's not very common. It's a viral disease. It's a disease that's similar to smallpox. We don't have a vaccine and we don't have a treatment for monkeypox. However, there are things that we can do to limit the spread of monkeypox and make sure that as few people as possible get infected.
So tell us about those things we can do.
Yes. Now, first of all, we need to understand how monkeypox is transmitted. It's primarily a disease of animals. That's why it has the name monkeypox. But it's not just monkeys. It's monkeys, rats, rabbits, and some other wild animals. Monkeypox is primarily spread through contact with infected animals, either monkeys, rats, or the other animals that I mentioned. And it could be from eating improperly cooked meat from these animals. Those who slaughter such animals, primarily those who prepare bushmeat, are also at risk. And people who have such animals in their vicinity, so personal hygiene and environmental sanitation is also important. But aside from that, there's also human-to-human transmission. So when an animal infects a human being, that human being can infect another human being, and that's usually the reason why we're very concerned. So how is it transmitted from humans to humans? By contact with infected individuals, which could be any kind of close contact, because it can be through respiratory drop-ins, it can be contact with infected things that people have touched, and other kinds of contact with people that are infected. So if we want to talk about prevention, how can we prevent monkeypox? The first thing is personal hygiene. Hand washing is very important. We need to make sure that we wash our hands as often as we can, particularly when in contact with people that are suspected to have monkeypox. If someone does have monkeypox, because the signs are similar to malaria, it's fever, general body pain, initially, then there's a rash. It's a unique rash, primarily on the face and the hands, but all over the body. And people that have this rash are able to transmit infection to other people. So if anyone has any signs and symptoms that resemble monkeypox, it's important to report that case immediately to the nearest health facility, such that such people can be taken to appropriate isolation facilities and stay.
The disease is relatively milder than smallpox and also non-lethal. Well, how long is the maximum span of the disease before it relieves the victim? How long is the maximum span of the disease before it relieves the victim?
Usually the disease doesn't last more than 3 weeks, most of the time. It's variable, but many times it doesn't last more than 3 weeks. Sometimes it's self-limiting. And even though we don't have a treatment, there's what we call symptomatic treatment, whereby in a health facility, the person can receive adequate care until the disease goes away on its own, because sometimes it goes away on its own.
So care, what would they be doing? Would they be properly hydrated?
Yes, the care we would provide would be hydration, analgesics, basically treating the symptoms till the human body is able to mount a response that can take care of the disease.
Now, it's in Bayelsa State. We had rumors about River State, but thankfully that was a hoax. But now it's in Akwa Ibom State. How do we prevent this disease from spreading any further?
Yeah, that's a good question. Because of the way Nigeria is so intertwined and people travel around from place to place, that's something that we have to be very concerned about. When people are sick, it's advisable that they do not travel. As much as possible, we need to follow the basic principles of hand hygiene. and respiratory etiquette. But if someone does develop a symptom, now this is not the time where people should go to maybe say a chemist or have some kind of self-medication. If anyone has anything that's like a fever or body pain, this is not the time to assume that it's malaria. This is the time to get to a hospital and make sure that you're checked to be sure that this is not monkeypox.
Thank you so much for sharing your thoughts with us, Dr. Oluwakemi Odukoya, a public health physician from the Department of Community and Healthcare from the Lagos University Teaching Hospital, Luth.